Thank you so much for having me and for organizing this conference. I'll be presenting on unemployment insurance and food insecurity among people who lost work during COVID-19. I'm grateful to my co-authors, Drs. Jacob Poor and Athene Venkataramani. Unfortunately, the COVID-19 pandemic and people physical distancing to avoid contracting the disease has led to a large loss of employment during the pandemic, and that has really been concentrated in an unprecedented way among people in the lowest earning households. So while people in higher earning households were more able to work from home, less likely to lose employment, and have largely recovered their employment, people in lower income households were much more likely to lose employment and have been much less likely to recover their employment since the pandemic started. And as you just heard, this has led to really high amounts of food insecurity. So in the most recent wave of the Census Pulse survey, 10% of all households and 14% of households with children reported not having enough food to eat in the past 7 days. And the numbers are even larger if you look over the course of a month. In this context, unemployment insurance took on incredible importance for people who lost work, and the CARES Act provided an additional $600 a week to people who were on unemployment insurance through July, but the CARES Act supplement has ended. Additionally, many people are not eligible for unemployment insurance in the first place because they have not qualified based on the base period, or they actually didn't earn enough to qualify for unemployment insurance. And so there are many people who haven't been able to get unemployment insurance, and many people for whom unemployment insurance will begin to expire. So in that context, we thought it was very important to understand how unemployment insurance has affected food insecurity, and to the extent that we can, to try to look at the $600 federal supplement to unemployment insurance and how that has affected food insecurity. So we conducted this study initially between April and July 2020, though we are now working to extend the analysis with now with the newly provided week 15 or wave 15 data from UAS, and hopefully wave 16 by the time this is published. So we used data from the Understanding America study, waves 2 through 7, April 1 through July 8th, 2020. And the inclusion criteria were that people would live in a household earning less than $75,000 in the past 12 months, that people participated in at least 2 survey waves, that they reported being employed in February 2020. So these are all people who had work in February 2020, and then who lost employment at some point during the study period. The exposure of interest was receipt of unemployment insurance, which was self-reported based on have you received unemployment insurance benefits in the past 14 days. And the outcomes were food insecurity and eating less. So food insecurity was based on the question, in the past 7 days, were you worried you would run out of food because of a lack of money or other resources? And eating less was based on the question, in the past 7 days, did you eat less than you thought you should because of a lack of money or other resources? We conducted a difference in differences analysis, as well as an event study, looking at how food insecurity changed relative to the timing of receipt of unemployment insurance. We included individual effects that adjusted for all time invariant individual characteristics like race and ethnicity. We included survey wave fixed effects that adjusted for secular trends and exposure to unemployment benefits and the outcomes of interest. As you saw, there was this peak in food insecurity right at the beginning. And then we adjusted for receiving the federal stimulus payment, for receiving SNAP benefits in the month prior to the survey, and for employment status at the time of the survey. We included people in this study regardless of whether they were employed at the time, because we didn't want a changing denominator of people as they shifted in and out of employment. So these are some of our initial results. These are the proportion of people who were employed in February and who lost work at some point by income group. And on average, among those earning less than $75,000, about 42% reported losing work at some point during the pandemic. And you can see that was even higher for people in the lowest income households, where 60% of people reported losing work at some point during the pandemic. This is reported food insecurity and eating less due to financial constraints by income group. And you can see again that that those earning less than $20,000 experience the most food insecurity, with 50% experiencing at some point between waves 2 and waves 8 of the survey. But even those earning $60,000 to $75,000 reported food insecurity at some point during the survey at very high rates. This figure depicts the depicts survey wave, so UCA survey waves, and the percent of people who reported food insecurity. So here, these are people who are not included in our study, but are sort of a point of comparison, people who remained employed and who had a household income of less than $75,000, that's on the bottom. Then the two lines at the top in red are the people who did receive unemployment insurance, and in gray are the people who did not receive unemployment insurance. And you can see that that food insecurity declined for everybody from a peak at the outset of the study, declined for everybody over time, but declined more for those who received unemployment insurance. So that by the end of the survey, they had lower levels of food insecurity. We see a very similar pattern for reporting eating less due to financial constraints. So again, we see that they red and the gray lines, the groups that did and did not receive unemployment insurance started out with very similar rates of eating less, and by the end of the survey, those with unemployment insurance were less likely to report food insecurity, or were less likely to report eating less. These are our event study estimates. So these are the number of waves relative to the start of unemployment insurance. And what's important here is to see that prior to receiving unemployment insurance, there really was not a significant difference in the trends in food insecurity for people who did and did not go on to receive unemployment insurance. But then after people received unemployment insurance, in the waves following that receipt, that they were less likely to report food insecurity. And the average difference in differences estimate is that there was a 4.4 percentage point decline in food insecurity. We have started to update this analysis, as I mentioned. So just looking last night at waves 2 through 15, we can start to look at unemployment insurance overall, as well as what happened when people lost the $600 care supplement. And so we find that unemployment insurance overall was associated with a very consistent 4.7 percentage point decline in food insecurity. But that losing the $600 care supplement was associated with a 3.5 percentage point increase in food insecurity. And this is just the same result for eating less. So again, looking at waves relative to the start of unemployment insurance, and we can see that prior to receiving unemployment insurance, there was not a particularly different trend, but then after people received unemployment insurance, there were declines in eating less, and perhaps the biggest decline is here in the first couple of waves after first receiving unemployment insurance. And overall, there was a 6.1 percentage point decline in eating less associated with unemployment insurance. So in conclusion, during the period when the CARES Act provided a $600 supplement to state unemployment insurance, receiving unemployment insurance was associated with a 30% relative reduction in reporting any food insecurity and a 42% decline in eating less due to financial constraints. And policymakers may wish to consider continued expansion of unemployment insurance eligibility, amount, and duration as an approach to reducing food insecurity during the continuing COVID-19 pandemic. I'd like to thank my collaborators and funders, the Boston University CTSI and the NIH. I would really like to thank the Understanding America study team, because I think it's just so remarkable that you are providing these data in such real time and on such a public basis, and making them so easy to access, and fielding requests from more and more trainees. So I'm directing to them as well, and I think it's just an incredible public good that you've provided, and really appreciate that. I really appreciate any feedback that anybody has. We have a preprint available here, and as you can tell, we're actively working on the analysis, so your feedback will help us strengthen our study. Thank you.